Hello, my geniuses. Welcome to another anatomy lecture series on the femoral triangle. It is your great tutor Lorenzo, and if you are new to this channel, make sure you subscribe. Please subscribe and turn on your post notification button so that when I drop any video, you will see it fast and watch it. And if you have any question, please drop it on the comment section because I will review it, and if it needs me to make another video, I'll make and send. Today we'll be talking about the femoral triangle using the following outline. The first one is the introduction to the femoral triangle, the boundaries to the femoral triangle, the content of the femoral triangle, and a clinical correlation. Now let us dive into the video. Now, the question here is that what is the femoral triangle? What is the femoral triangle? From the name, the femoral triangle is a triangular shaped space or a triangular depression on the upper anterior medial aspect of the thigh. A triangular shaped space in the upper anterior medial aspect of the thigh. What does it do? It transmits what we call the neurovascular structures from the pelvic to the lower limb. From the pelvic to the lower limb. Now, the next thing is what is the boundaries? Now, the boundaries of the femoral triangle. We are talking about the boundaries of the femoral triangle. What are the boundaries of the femoral triangle? Remember the mnemonic SIA. SIA. Sartorius, inguinal ligament, and the adductor longus. Now, superiorly it is bounded by the inguinal ligament. In the lateral border, it is bounded by what? The medial border of the what? Sartorius. In the medial axis or medially, it is bounded by the what? Medial border of the adductor longus. SIA. Medial border of the sartorius laterally, superiorly inguinal ligament, and medially medial border of the what? Adductor longus. In the apex, the meeting point of the medial border of the sartorius and the what? Adductor longus. So in the apex is just where the what? The sartorius and the adductor longus meet. Again, what is the floor? The floor is, just remember, PIA. The floor of the femoral triangle is PIA. What is P? P for what? Pectineus muscle. P for what? Pectineus muscle. I for iliopsoas. I for iliopsoas. What is iliopsoas? Iliacus and psoas major muscle. And the last A is for the adductor longus muscle. Don't forget, the floor of the femoral triangle is PIA. Don't forget PIA. Pectineus, iliopsoas, and the adductor longus. The roof of the femoral triangle has a layer called the skin, the superficial fascia, and the deep fascia. The deep fascia is the facial latter, which has an opening called the saphenous opening. The saphenous opening is where the great saphenous vein drains into the femoral vein. It also contains cutaneous vessels like what? The femoral branch of the genitofemoral nerve and the superficial inguinal lymph nodes. Now, since we have discussed all this part, let us go to the content of the femoral triangle. So let us discuss about the content of the femoral triangle. What is the content of the femoral triangle? What passes through the femoral triangle? Now, use the mnemonic NAVeL. 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 So when you remember NAVeL, you remember the content of the femoral triangle. N being femoral nerve, A being femoral artery, V being femoral vein. There is an empty space before L, which is the lymph node, the femoral lymph node. The lymph nodes around the femoral artery. So since we have understood this part of it now what is the E? Empty space. What is the empty space around there? The empty space allows for dilation of the what? Femoral vein during venous return. So there's an empty space so that the femoral vein can dilate, open during when there's increase in blood flow to that area. Now, one thing you have to know for the purpose of your exam is that the femoral artery and femoral vein is inside the femoral sheath. You get it now? The femoral artery and the femoral vein is inside the femoral sheath, and the femoral branch of the genitofemoral nerve pierces through the femoral sheath too, and innervates the anterior compartment of the thigh. So just don't forget it. The femoral nerve is not in the femoral sheath, and it is lateral to the femoral sheath, so don't forget it. So this is the content of the femoral nerve. So what now? The next part we'll be talking about here is the clinical correlation. So what is a clinical correlation? How is this relevant to clinical practice? Now, you know that the femoral artery, there's a femoral pulse, and sometimes the arterial blood pressure, the blood pressure of the arteries can be felt there too. You get it now? And also the femoral vein can be as a site to thread a catheter to reach the heart. So one, the femoral vein, you can use through the femoral vein to thread the catheter, and the artery, you can feel the femoral pulse there. Finish. So this is one important thing about the femoral triangle. Hope it all made sense to you and you understood everything about the femoral triangle. Please, if you are new to the channel, like I said before, please subscribe and turn on your post notification button so that anytime I release any video, please you will see it and you watch it. And if you need any video, just write on the comment section and I will be sure to do what to make the video for you. And any video you want, also search through our catalog for the video, and I'm sure if it is not there, I will make one for you. Thank you till we meet again in the next lecture series. Goodbye. Thank you.